Let's talk about the different routes of administration for hormones and peptides.
Sure. So you can see here we got the various different kinds. Um, One of the most common ones is an oral medication or an oral pill. This one is BPC 157 here, but it's just like a regular capsule. Not too big, easily to swallow, smooth, and you just take it with water on an empty stomach. The next one here, this one is an applicator. So on the front here, it tells you per one click or half click how much you're going to get. So that again depends on the compounded pharmacy, and it depends on what your needs are as a patient. Simple as this though, you just turn and lotion comes out. The third is a nasal spray. So similar to the nasal sprays like Flonase and any over-the-counter nasal sprays, you pop off here, you take the safety squeezer off, place in your nose, and dispense one time down. And it's a one-time dispense, and you do it once a day. The next one, this is actually DSIP. This is one of the peptides. The vial that it comes in is pretty typical. There's times though where you might get a larger or smaller vial, or a vial where you need to mix it, but this is pretty typical. This is the insulin syringe that you use in order to inject the peptides in the subcutaneous tissue or the fat tissue. But here's the size of it. It's very tiny. There's nothing much to it.
I can't even see it, honestly. Oh wow, that is small.
So a lot of people who have needle phobias or afraid of needles, they don't realize how tiny this actually is. And most of the time people don't even know that they're getting it done, especially if someone else does it to them. That's how tiny it is. You can also use these needles for hormone replacement therapy injections as well. So people who don't like these bigger needles, we can transition to the subcutaneous. These needles, there's two of them here. This needle is a little bit bigger, but this needle is to take the medication out from a vial. So you put it in and draw it out, and then you would interchange the needle itself just like that, put a smaller needle on, and then inject into the muscle or intermuscular. So into the muscle here in the arms, in the buttocks, or around the thighs or legs. And then here is the smaller needle. So it's a lot smaller, so it's a little bit more comfortable, not as much discomfort when you're injecting compared to this size needle. Ultimately, the route the route that you choose depends on a couple things. It depends on the medication. So for instance, this peptide here only comes in a nasal spray. Hormones can come in oral, so like a pill, or a troche, which goes underneath your tongue, a little bit smaller than the pill, but you kind of let it dissolve like a mint. A cream based, or injectable base. And again, we can transition this needle to a smaller needle like this in order to inject. So again, it just really depends on what drug you are going to be taking, whether it be a different peptide or a different hormone, and then what is most comfortable for you and what you're trying to target. These needles are always the better, most clear route, because when we start going into digestion and things of that nature, it kind of decreases the strength of these medications. But again, if the medication, the peptide, the hormone comes in the form it comes in, that means it is perfectly an available route to take the medication.